Hey guys, welcome back for another episode of 5-Minute EMS Review, where we give you short and to the point videos on different EMS topics. Today, it's the Pediatric Assessment Triangle. Let's get started. If you're like me, you get a little nervous anytime the tones go off for a pediatric call. Nobody likes a sick kid. And on top of that, most of us EMS providers do not have the same repetition and frequency of pediatric population calls as we do with other patient populations, which gives us less experience and less exposure to that population. So it can be a little nerve-wracking. But today we're going to talk about an assessment tool that can help us anytime we are approaching a pediatric patient. It's called the Pediatric Assessment Triangle. The purpose of this tool is to give us a observation-based method to examine the status of the child and how sick we think they are, how stable or unstable we think they are, based simply on just looking at them. So we can employ this technique as we approach them and perhaps as we start to get to them and get our hands on them, but it's meant to be initiated from across the room just looking at the patient. There's 3 legs to the pediatric assessment triangle. The first is the patient's appearance. And when we talk about appearance, we're referring to their mental status. So we want to look at the patient and try to determine, how do they appear to us? Do they appear to be alert and oriented with their environment? Are they appropriately engaging with their environment? Are their eyes tracking? Are they following the people that are around them and interested in what they're doing? Or are they very lethargic with poor muscle tone? Maybe their eyes are just tired or rolled back in their head. That would be a cause for concern for us. Or perhaps they're not responsive at all, or they're hard to rouse. These are observations that we can make as we approach the patient to give us an idea of what their mental status is like. Now, moving to another leg of the triangle, we have their circulation to the skin. This gives us a good idea of their perfusion status, again, simply by looking at the patient. And what we're doing here is we're trying to look at, how is their color? Do they have good color to their skin that indicates that they're perfusing well? Or do they have pale skin, or perhaps cyanosis developing around their lips or in their fingernails, indicating lack of oxygen to their tissues? Another thing that we can look at is the condition of their skin. Is it clammy? Is it profusely sweaty? And as we approach them and can touch them, is their skin dry, or is it warm or extremely cold? What is the temperature of their skin? All of these things can really give us a clue as to the patient's perfusion status. And we can even employ the capillary refill test as we reach the patient and are able to get to their fingernails and look at how quickly do those fingernails restore blood to the tissues after we blanch the nail. That can help us see their circulatory status. So we've crossed off the mental status and we've crossed off the C of the ABCs. Now, the other thing that's left in the pediatric assessment triangle is their work of breathing. And as we look at this, we're basically checking their airway and their breathing, their A and their B. So based on how they're breathing and any noises we can hear, we can determine fairly quickly whether or not their airway is patent. And then from there, we move to the observations about breathing itself. Are they breathing? Yes or no? Is it adequate? Yes or no? We want to look at the rate. Is it normal, or is it too fast or too slow? We want to look at the depth. Is it really shallow, or are they taking really deep breaths trying to get in as much air as possible? And then finally, we want to look at whether or not they're recruiting extra accessory muscles in the neck or in the muscles between the ribs to really work extra hard to get that rib cage lifted and pull in as much oxygen as possible. These are all clues that can help us determine how well or not well the patient is breathing. And so from this pediatric assessment triangle, these 3 legs, we can put together some information about the mental status and the ABCs of the pediatric patient. Basically, doing a quick primary assessment as we enter the room and look at the patient. And this can help us as we progress forward with knowing what our priorities are and how we need to approach this patient. So I hope that was helpful. I hope that's something that you can add to your toolbox and employ the next time you're dealing with a younger patient, particularly those that can't communicate super well with us. This seems to be very helpful in those situations, because the less you can interact with the patient and ask them questions, the more it becomes helpful to gather information by observation only. So again, I hope that was helpful. If you found it to be, we would love it if you would go to our homepage on the YouTube channel, check out some of the other playlists that we have for some different topics, and please share our channel with anyone else that you think may find it useful. We hope you'll join us next time, and we'll see you then.